Good morning. This is Dr. Bill White again with the American Orthodontic Society, and I want to talk to you some about the TMJ problem and show you how the occlusion, or the way the teeth come together, and how the teeth can force the jaw to stay back, and the jaw can be back so far that it's pressing on the retrodiscal tissue and causing it to be irritated and sore, and people have problems with it from simply the occlusion of the way the teeth meet. So if you could correct the occlusion, in other words, let the jaw go back out where it wants to go, the discomfort and the pain in many of these cases just goes away if you alter the occlusion. So there are three cases here. I'm going to just show that there's different things with the occlusion that's causing this. And so we'll start off here. Let's see, I'm going to have to go back over here and get this little pen going. All right, here is a gentleman that, he's really must be a brain. He was head of the department in American Airlines doing the tickets all over the country and the world, and he had this TMJ problem that was just so bad he could hardly do his work. Just the nicest guy you ever saw, though. He's a real fine guy. And so here's the way his teeth met. He had some porcelain, the backs of these teeth were porcelain, and that porcelain is just like a wet rock, and his bite was closed down like this, and he kept pushing, trying to get his jaw further forward, and just ground the lower front teeth off like I've never seen before. But anyway, this was the problem. So we had to open his bite and move this out and get this away and recrown the lower front teeth and open it, freed his jaw up, and the problem went away completely. Now, I thought that this man was under so much stress that was one of the main causes, but really just when we got his occlusion to where his jaw could go where it wanted to go, he stopped having problems with it. And let me just go through the case here right quick. And this is the lower jaw. Now you think, well, gosh, he's got these teeth are crowded out of place, and he ground these off till there's nothing. It goes all the way down to the bone, down on the front part of the teeth down here. And we had a devil of time getting anything on them, so I had to put bands on the teeth and fill them with composite and use the brackets off the bands to open the bite. And when we got his bite opened up, it was enough room in there we could expand this right in here and put these teeth in place. You'll have to watch this. This is a neat case, and he sent some other people from his office that had joint problems too. And so let me go on to show you the other. Here are these front teeth. They are literally ground down the whole thing off here. So for me to correct this, I had to put bands on the teeth and fill them with some with composite or something to fill this out, so I could use the brackets on the bands, you see, to control the teeth. Now his teeth were, I've got a picture out here, I think, where he bites down, and so you see his lower front teeth are completely up in underneath here, and you see the jaw is in a class 2 relation. We need to put this red spot right over that, and here is that crowded out space. So when we got his mouth opened, we had room to put this bicuspid in this area, and we had room to bring this down and get it and crown those teeth, and his jaw was free then for him to move it forward, and it didn't want to be back there. So the condyle was back here pressing on this retrodiscal tissue, and it's highly vascular where it produces all this synovial fluid, and it gets inflamed. And brother, I tell you, when that thing is inflamed, you can't touch it. I've had mine hurt too, and I've had many patients. You just go to touch it, no, I don't want you to touch it. It's so sore. It just gives you a fit back here. And when you free this jaw up where the condyle could move further forward, this lets this heal back up, straightens back up, and his TMJ problem went away that he had for several years in there. So let me erase this, and we'll go to the next picture. Now there we had opened the bite, and this cuspid that was over here now is in this position. Let me go back and see if you can pick that up. See where the cuspid is. We're going to bring it back. And there it is again, there, back in place. And that's where it was when we started in 1993, I think. You couldn't see the lower teeth. Were completely covered up, and they went up to here somewhere in his mouth, though, and his jaw could not come forward, and subconsciously, I guess he ground it back and forth, and just wore those teeth down to almost nothing. There it is. And now we open the bite, and if you want to go back, I've got a video on him, a whole thing, if you want to look at it. But anyway, we open the bite, and then the guy that sent him in crowned these teeth right in here, and those are the ones. And we put where this would rub against the upper, and we kept from wearing it down again, but actually the jaw's free, and the young man could bite with these front teeth. His lower jaw could come forward, and he had room for his bicuspids to come in on the sides like that. And that's the way the upper was. There the upper is after we got through. We did not change the upper, but anyway. And now these are the crowns that his regular dentist put on those teeth and built them back up to where he has a nice smile, and his TMJ thing is gone. And that's a very gratifying thing to be able to see what's wrong with that. And you see the place where these teeth are. You know, we opened that up. When we pushed this down, it gave us room down there to do that. And you take somebody that restored their dental situation, and you stop the pain too. And here's another guy that I worked on for several years, and he had so much pain. He took so much medication, he couldn't hardly hold his job down. So he had, look at the problem he's got. So he's got the deep bite. His jaw is trapped back underneath there, and he can't move it forward either. Very same thing, the occlusion, but his is on the side, I think. Now, the way this is meeting, and he's got a bicuspid crowded out here and a cross bite fitting right in this area right here. Now this is in a class 2 relation. In other words, he can't get his jaw out here where it ought to be, and this cuspid ought to go in that spot right there. And you'll see when we depress these and depress these up here, open the bite up like that, put a retainer in there that won't let him close the bite again. Same thing over on the other side was much better. This was in a pretty much class 1 relation. You can see that the teeth fit. So this side wasn't bothering him much, but it was the other side that was giving the trouble. And his upper teeth were wore down. They had worn the back of the upper teeth off on those teeth he had. And so that was the problem. But that's where it locked the jaw back and it put pressure in that retrodiscal tissue. And he had problems with it. And we watched this man till he got to be an old man, really. Well, this tooth didn't have room enough in here, so as we intruded this anterior part, it gave us room, so we pushed that tooth into that position right there and also freed his jaw up, and his TMJ problem went away. Now he has to watch it. See, when I shot the picture of the model where his lower teeth were right up in underneath here. Now we're going to depress all these teeth and have it come along like that, and then we have room to push this tooth, I believe the one was out, push it in place there. So here, this is where we started off like that in 1982, and we ended up here. Now this tooth was discolored right here, but I don't know whether he deadened that tooth or got it hit or broke the nerve or something, but that was discolored when we started. But when we got room enough in there and opened the bite, he stopped having the TMJ problem. That's the right side was okay, and the left side, we got the right one back further, and the left, we were like that. We opened it up, and in other words, we intruded these, and we intruded these teeth here, and it let the jaw go. We had a midline problem because we had to move it more on this side than we did the other side. So we would come in here with class 2 elastics and midline elastics, and over on the other side we might have used a class 3 elastic. But you can shift the jaw around like that, and at the same time gave them room for the teeth to meet, and this jaw joint problem went away and went to here, and he didn't have the problem now. Well, this is several years later, and we saw him, and he got completely gray-headed before when he was bald-headed, really. You can see and look at the difference in the two jaws. I mean, look at the size of this right here. And people say, well, you can't spread their jaws out, you can't widen that out, you can't do all this. This is not right. You can move these. I can move these teeth out here, and the bone that's on them will go with them. That will go with them. And we do it all the time. Look at that, and look at this. Now, of course, I'm up closer, I think, and I haven't widened it all that much, but I've widened it a good bit in there, and the bone's still good on these teeth, everything. I didn't have to move it, and she got these out where he's not biting the backs of them. And go back and look at that again. Let's see if I can, you see where he was chewing on that, and those bottom teeth were coming up and hitting right in here. And so we got rid of that, opened it up, and now he's looked like that. Now this is several years later. I don't know. We watched this man for probably 20 years and kept him going. The teeth aren't hitting in the place they ought to. When he bites together, he's better. And this is the upper arch, much later. All right, this much younger man here, this happens to be Dr. Mike Worley. He won't mind me using his name. He took my practice when I was 75. I went over and he took over the stuff, and I worked with him for about, I believe it was 12 or 13 years after I retired from my office at 75, and I worked with him till I was 88 years old. And Mike's a neat guy, and I was out eating with him one time, and well, this is when I first met him, everything, and he looks good, his jaws are lined up good, and he chewed with his jaw like that. In other words, had his lower jaw back here, and he would chew his food there, and I kept watching him. He would eat with his jaw back in the right position. They fit together better than that. That's not a good picture of him. But then he would turn around and bite like that. In other words, he bite this way, and then he'd bite this way. And he was chewing his food. And I said, "Man, what are you doing?" And he said, "Well, my teeth fit together better back here, and I can chew back here, but my jaw hurts up here when I do that. So I'll move my jaw out here, and I can chew it. It doesn't chew as good when it's out like this, but he said it doesn't hurt at all." And all he was doing is moving the condyle out of the way, and he'd go back. He was hitting this retrodiscal tissue. So we had to move the maxillary teeth further forward and got it to where his jaw didn't rub the retrodiscal tissue, and the TMJ thing went away. So the occlusion can cause TMJ problems for people. And there he is in his forward position. When he chewed like that, he didn't have good contact, but his jaw did not hurt. And when he went back to the regular, this is the way he chews without hurting it. But when he bites like that, it hurt. And so we had to go in and work on that. We tried some Invisalign and stuff and didn't have any luck with it. So anyway, that's 3 cases, and I can show you case after case after case where we freed the jaw up. Sometimes class 2 division 2, something like this. And there's a guy going around the country, and he one of the people that was taking our course was in his course, and he's got somebody that hurt him for years. He didn't know any orthodontics. He deadened it and ground these teeth off and did root canals on them, got them out of the way, and this lady had been hurting for 10 years, went back to her hotel. She's from Ohio somewhere, and came back, and this young man that was taking my course was in the course and said, I couldn't believe it. She came back and hugged his neck and said the first night's sleep she'd had in I don't know how long. But all he did was just free the teeth. And you can take somebody and move these teeth up and raise them up and free it up and get the same results if you learn a little orthodontics. And so I encourage you to go in and take some courses. The American Orthodontic Society, I'm hoping that we'll get these webinars where they're international and you can take these courses. We're working on that. And there's some people in our organization that can teach this, but you can take these videos and learn a lot from it. So thanks for watching, and we'll appreciate you joining our group. Subscribe to it, our channel, and love to have you. So I'll hang up here and say goodbye for the time being. We'll have something else come up before too long, so I'm going to stop.